Welcome to Utah Hair Restoration, and thank you for coming in for a consultation. The majority of men that are losing their hair suffer from a condition called androgenic alopecia, or genetic hair loss. Genetic hair loss, as the name implies, is genetic. It comes actually from both sides of the family. There's an old wives' tale that the mother's father is the pattern of hair loss that you will have, but in fact, hair loss comes from both sides of the family. There is a gene on the X chromosome that comes from the mother's father, but other genes that control hair loss are found on autosomal chromosomes, so they can come from either side. The most important thing for you to understand about hair loss is that genetic hair loss is progressive. And basically what that means is what you see today is not what you'll see 5, 10, 15 years down the road. So whenever we're approaching hair loss, we have to remember this and make sure that we're taking care of your situation today as well as many years down the road. If we were to loosely categorize the treatments for hair loss, we would categorize them into those which help maintain current existing hairlines and those that reverse the hands of time or correct some of the loss that you've suffered from already. There are three main treatments that we use to maintain your current situation, to keep the existing hair that you have. The most effective treatment for maintaining hair count is a medication called Propecia, or generically known as finasteride. Finasteride has been around for many, many years. It comes in both a 5 milligram or a 1 milligram dose. The 5 milligram dose is used for prostate growth. The 1 milligram dose is used for hair loss. The way that Propecia works is it blocks the conversion of testosterone into a hormone called dihydrotestosterone, or DHT, so it effectively lowers the level of DHT. Propecia is very effective at preventing future loss. In fact, in the original FDA studies, they showed that about 90% of men stopped losing their hair when they were taking the medication. That's the main reason that we use Propecia. It is to prevent future loss, to keep you where you're at. There are two main side effects that you must understand before you start taking Propecia. The first is that if a woman is pregnant with a male baby and she touches, handles, or consumes the pill itself, it can cause birth defects in the baby. It can be absorbed through the skin, so make sure that if there's any possibility that anyone you're associated with is pregnant, that she doesn't get in contact, physical contact with the medication. Now, it doesn't pass from a man to a woman, so if a man's taking the medication and he kisses or has other relations with a woman, it doesn't pass from him to her. The second side effect that you must understand is that in the original FDA studies, they demonstrated that about 6% of men taking the 1 milligram tablet reported a drop in their libido or sex drive. That number was 12% in those taking the 5 milligram tablet, 3% in those taking a sugar pill. I certainly have seen that in my practice. I've had patients that come in and they say when they're taking Propecia, they have zero sex drive. In the original FDA studies, they demonstrated that that side effect was temporary, in that if they continued to take the medication or if they stopped taking the medication, their sex drive all returned to normal. In recent years, there has been some concern that there may be permanent or irreversible side effects caused by this medication. The studies that have been performed so far have not demonstrated permanent side effects, and when they've looked at study populations, they haven't found statistically significant differences in those taking the medication or those not taking the medication in causing this side effect. And yet there's a lot of press. If you go and you Google erectile dysfunction associated with Propecia, there's many people that are blogging and discussing, talking about this. Again, it's something that I should discuss. You should be aware that this is a possible side effect. There is also a syndrome called post-finasteride syndrome, which also is associated with sexual dysfunction in those taking the medication. Again, the studies have not demonstrated a statistically significant link between the medication and post-finasteride syndrome. As the name would imply, there may or may not be an association of finasteride with post-finasteride syndrome. Again, you should be aware that this is a possible side effect. Currently, the WHO, World Health Organization, has classified post-finasteride syndrome as a rare side effect. Is it possible? We just don't know. When I come into the room and evaluate you personally, we'll further discuss the indication and usefulness of Propecia in your situation. Remember that the medication stops hair loss, so it's most effective if you start early and take it for the rest of your life. Those planning on taking it for just a short period of time, it hasn't been shown to be effective in that fashion. If you start taking the medication, your hair loss will stop, but as soon as you stop, your hair loss will accelerate and you'll catch up with where you would have been had you not taken it in the first place. So the principles to understand with this medication is, number one, the earlier you take it in the hair loss pathway, the better off you'll be. It's better at keeping your hair than it is at regrowing hair. The second is that if you want to take this medication, it's something that really should be approached in planning on taking it for the rest of your life. As long as you care about hair, that's how long you should take the medication. The second medication that we often will use in association with androgenic alopecia is minoxidil or Rogaine. Rogaine has been around for many, many years, 20 plus years. It's a topically applied medication, so it's placed directly on the scalp. The way that Rogaine works is it helps to thicken or coarsen the existing hair that you have. In fact, it'll work anywhere that you put it. If you take it and smear it on your arm hair will grow thicker and coarser. It really works on the miniaturization process that happens as we begin to lose our hair, where hair shrinks in caliber or thickness and becomes finer and finer. It works very well in situations where somebody has hair that's started to miniaturize but hasn't gone away completely. If you take minoxidil and you smear it on bald scalp, it won't do much of anything. It's a very safe medication. It's over the counter because it has such a good safety profile. About the only side effect I've ever seen with the medication is some people will develop a topical allergy to it when they've placed it on their scalp for many, many months. That generally doesn't start right away. It'll take 6 months, 9 months to a year before they'll develop a topical allergy. If that happens, you'll just have to stop using the medication altogether. It works very effectively, but can take many months before you see the overall effect. Remember, it's stimulating the hair follicle at the base of the follicle, so you have to wait for the hair to grow to full length before you'll notice the impact. So generally, I recommend that you use it for at least 3 months before you give up on it. It does have to be used twice a day. It can be used once a day, not as effectively as twice a day, less than once a day. If you're not using it that much, it's really not doing much of anything. The final treatment that helps to maintain your current hair count is something called low-level laser therapy, or LLLT. I use a device called a capillus device, and essentially what it is it's a baseball cap that goes on the top of your head. There's laser diodes, 272 laser diodes that deliver laser light to your scalp. Very effective, mostly at helping you hang on to your hair. It's an FDA-approved device, so it has been shown by the FDA to be effective at helping maintain hair count. It needs to be used approximately 4 days a week, so Monday, Wednesday, Friday, and then either Saturday or Sunday for 20 to 30 minutes at a time. It's very effective at helping hang on to hair. I love using the laser therapy in situations where the person is unwilling to use Propecia, but I would otherwise recommend Propecia, or in women, because Propecia is not effective in women. The laser cap is sold. It comes with a rechargeable battery pack. You place it on the top of your head, turn it on, and you can do most of your normal activities. You can drive in your car to work. You can put it on, vacuum, put it on, watch TV. So again, it's very effective, but you have to use it. If you're the type of person where it's going to be used for about a month and then it's going to sit in the upper drawer of your dresser, it's not doing anything. So I really like to use it in people that will find the time and availability to use this as a therapy. Virtually no side effects from the low-level laser therapy. Very safe. Delivery of laser light for many, many years has not been shown to cause any type of harm or damage to the skin. Finally, let's discuss ways that we can reverse the hands of time and restore hair back to where it's gone away. The main treatment for restoration of hair loss is a hair transplant. Effectively, the basics of a hair transplant is that hair has a characteristic where you can move it from one location to another and it doesn't know that it's changed places. You can take hair from the back of the head and put it anywhere on the body and it'll continue to grow like it did on the back of the head. So if you took hair from the back of your head, stuck it on the tip of your nose, it'd grow long all the way down to your belly button. It doesn't turn into nose hair in the new place where you've put it. It still thinks that it's back of head hair. We use this characteristic that hair innately has, taking it from a location that it won't fall out from and moving it to a location where the hair has begun or will fall out in the future. It's a surgical procedure where we do this in the operating room under an anesthetic. We numb the entire top of the head. We remove a strip of hair from the back, or we can take hair individually, one hair at a time from the back of the head, which is the scarless or so-called follicular unit extraction technique, and we place the hair up in the front. Really, the most important aspect of a hair transplant is the artistry of the hairline design. There are some aspects of the procedure and rules that are very important to obey in order to achieve a natural look. Creating a hairline that's natural, that's not too low, not aggressive or juvenile looking, but at the same time placing it in a spot where it'll frame your face with hair and lend to the aesthetics of your face. The angle that the hair is placed at, in that it should be an acute angle, forward facing, so that it angles towards the front of your face and then can be styled in any form or fashion. Again, this is a natural growth pattern that hair forms. Thirdly, making an irregular broken line at the hairline. Remember that hair doesn't grow as a surgically straight line. So if you make a surgically straight line, it looks unnatural. It should have little peaks and valleys and variations that are consistent with natural hair growth. And finally, using single hair grafts at the anterior frontal hairline, making sure that you're using small, fine hairs right in the beginning for the first ½ centimeter, and behind this, using larger grafts to build fullness, using normal, natural growth characteristics to your hair. Replicating nature is the way that you can get the most natural, non-transplanted overall aesthetic result. Let's discuss the use of PRP, or platelet-rich plasma, during a hair transplantation. PRP comes from you, so it's harvested as blood out of your arm. The blood spun down, and approximately half of the volume is separated into platelet-rich plasma. In platelet-rich plasma is found platelets, plasma, growth factors, and stem cells. We use PRP injections during a hair transplantation. The PRP, the platelets, seal the grafts into place. They make the grafts sticky so they hold in position better. They help with hemostasis, so there's not as much bleeding as we're doing the operation. It helps with the recovery. It helps with the overall take rate. So I like PRP used in conjunction with a hair transplant. I'd like to talk about two different harvesting techniques when doing a hair transplant. When doing a hair transplant, the hair is taken from the back and moved to the front. Now, hair can be harvested in two different mechanisms. The first is the most well-established, accepted way to do a hair transplant, called the strip technique, or follicular unit transplant, FUT. Essentially, this procedure is performed by excising a strip or chunk out of the back of the head. It's sutured closed, so you end up with a fine linear scar on the back of the head. That piece of scalp is then taken and divided into the individual hair follicles. Those follicles are then placed up in the front in the recipient sites that I've created. The second technique is a newer or novel way of approaching and extracting hair from the back of the head. This is done with what's called the follicular unit extraction, or FUE technique. The scar is visible with the FUE technique when wearing the hair short. I've found that hair needs to be worn to a ½ an inch or longer in order to cover the scar in the majority of people. This is about a number 4 clipper on the back of the head. So if you need to wear your hair shorter than that, or you need flexibility with hairstyles, then FUE may be the best approach. If you have worn your hair long on the back of your head for many, many years and you don't anticipate changing this over time, then follicular unit transplant, or the strip technique, is most likely acceptable for you. If you have further questions about finasteride and its potential side effects, I would refer you to the International Society of Hair Restoration Surgery website, where you can read the findings of a task force and their discussion of the controversial aspects of the use of finasteride in hair restoration. If you're here for a consultation, I'll be in just a few minutes, and we can decide what's best for your individual needs.